Type 2 diabetes used to be called maturity onset diabetes or insulin independent diabetes. And again, those names have been changed because type 2 diabetes can occur at all ages. We are in fact seeing much more diabetes in very young people, which is a change that is occurring in our country now that is obviously a negative change. Type 2 diabetes is the most common type of diabetes. It occurs in 95% of the population. Some type 2 diabetics require insulin, but most do not. Most are treated with other medications. In type 2 diabetes, the problem is not that the beta cells of the pancreas are not releasing insulin, but rather that they are either not releasing enough insulin or that the person has become resistant to the action of insulin, so the insulin cannot do what it's supposed to do. Sometimes actually there are no symptoms at all, so people are sometimes find out that they have type 2 diabetes when they go to their doctor, they get their routine blood work done, and they find out that their blood glucose levels are too high. The most common symptom that can occur is fatigue, and the other symptoms that can occur is the symptoms that are characteristic of type 1 diabetes. So they can again get the excessive urination, the excessive thirst, the excessive hunger. Weight loss, less common with type 2 diabetes, but it can occur. It is just as important as it is in type 1 diabetes to keep as good control of your diabetes as you possibly can, to eat properly, to take whatever medications your endocrinologist has prescribed, to exercise properly, again to decrease the likelihood of the long-term degenerative complications. Complications of type 2 diabetes are basically the same as type 1 diabetes. They are not as likely to occur, but they can occur. Again, the more poorly the diabetes is controlled, the more likely they are to occur. So those complications are renal disease, heart disease, visual impairment, potentially leading to blindness, and neuropathy.